Live your life is right. Wait, I know I said we were almost done, but real quick. I mean, because this is an issue, and this is something nurses don't talk about, and I feel like you must deal with this a lot. But what do you do, and what is your advice for those nurses, other nursing students that failed the NCLEX the first time? Like, what is your quick advice for those folks? Because that's a rough situation.
It is. And, I always am very transparent, and I let people know, like, I don't know what that feels like personally, because I'm a great test taker. And so I passed my NCLEX at 75 questions, one and done. So I can't be sympathetic, but I can be empathetic, right? I know what that feels like. And the biggest piece of advice that I would let any new student nurse know, or not even a new grad, just a student nurse, period, is that don't get in your own head about it, right? You failed it, and that's okay. And now you need to pick the pieces back up and start again. Give yourself a good cry if you need to. Allow yourself to feel the feelings that you feel. If you're disappointed in yourself, sure. But then pick back up and have an honest conversation with yourself. Why did I fail? How come I failed? Was I not studying consistently? Was I not giving it the right amount of hours in the day? Do I need to have, a professional program like I think a lot of people use Kaplan, they use Hearst, they use UWorld, they use ATI. Do I need to get the help of all these other, more professional organizations to help me? Is it that I scheduled the test too soon? Is it that I got so many questions on this one particular thing that I know that I haven't studied and I'm not that great on? Like, for example, I wasn't strong on mother baby. And my first question on my NCLEX was a mother baby question. And I said, oh my goodness, this is how I'm starting. But, if you have to have an honest conversation with yourself after you fail the NCLEX. So yes, feel what you feel, but don't spend too much time sitting in it, because we're winners. We're champions.
Exactly.
Right? And so a fail is a fail if you just let it be that. It's not a fail unless you say, okay, I'm never taking the NCLEX again. I'm not going to be a nurse and I'm done. That is just an obstacle to your goal. So see it for what it is, self-reflect on how come it happened, and then pick yourself up and keep going. Like, that's it. We don't stop. Someone did Nursing with Finesse, that told me that she failed her NCLEX like 8 times.
Whoa, she needed Nursing with Finesse, girl. Good for her, though.
Inspirational person. Like, when I look at her, I say, you inspire me so much, because that couldn't be me, because I would have gave up. She knew what she wanted and she went after it. So if there is someone who could have failed that many times and was never discouraged, then there's no excuse for anyone else. If you want something, you work at it. And the reason, it was more of a sort of a language barrier for her as well. But if you want something, you go for it. She is a brilliant nurse. When I ask clinical questions so that I can help them start thinking more critically, she answers the questions like this. It was more of a language thing, reading questions that are that advanced, when there's a barrier, but she never gave up. She had a goal and she set her mind to it. And when she hit one obstacle, she said, cool, I'm going to hit another obstacle. I'm going to keep going and going and going and going. If you want it, you're going to work for it. So I had this video, it's like 2 years ago. I said, if you failed your NCLEX once and you discouraged, and nursing wasn't for you to begin with. So then that's it. That's it. That's my raw advice. If you failed it once and you're done and you're discouraged, then it wasn't for you, because there's so many more obstacles that we have to overcome, that if that messed you up, then you just got to reevaluate the whole thing. Pivot. This is what happened. Now let me figure out how to do better at it next time.
Well, I think you need to look into management, because, girl, you got the positive vibes. You got positive vibes.
They could